Okay, so I am back for part 2 of the CPT book. So I'm going to talk about that in a little bit. So let's go on, and then as my students come back into the class, then we'll keep going, and then that'll be it. Okay. So I'm going to talk about the table of contents. So what I'm going to do is go ahead and put this on pause until my students come back. Okay, fantastic. Okay, so we're back. So we're talking about the place of service codes. Hope y'all can see that. Turning the pages to the table of contents. And so we're talking about the all of what's in the table of contents here. And the evaluation and management codes. Then you have the anesthesia guidelines. And, you have the evaluation and management guidelines. It's telling you how to code. Be sure you read your guidelines, study your book, become familiar with it. You're not going to memorize every single thing. Do you see that, Chris? Go where it says table of content. Okay, so at the bottom here, your evaluation and management. Your evaluation and management is where the guidelines are right here. I don't know if y'all can see that real good. Okay, and they start with the codes here. So this tells like how long the physician saw the patient. When the physician makes their hospital rounds to see the patient in the hospital, they have to charge for those 10, 15, 20, 30 minutes that they've seen the patient in the hospital. And that's where the place service codes come in. So even though you use a CMS 1500 code, you're going to use a physician office visit evaluation and management code that says he visited a patient in the hospital with the place of service code 21, and you're going to place that charge there. You're going to pretty much know what the charges are per code, and they're called the RBVS, Relative Base Value System, and it's already calculated by CMS, which is Centers of Medicare Services, Medicare and Medicaid Services, done by the Healthcare Financing Administration. And they make sure that the charges are not overpaid or underpaid. So no matter where you are within the 52 United States, every 99201 is the same. The charges are the same. Every 99202, the charges are the same. Every 99204, 205, they're all the same in all 52 United States. Okay? All right. You have anesthesia guidelines. You have anesthesia codes. So this goes in a certain order. Turn the page here. You have the surgery guidelines. So if you want to be a medical coder and biller for a family practice doctor, you're going to mostly use the E&M codes. If you're going to be a family coder and biller for anesthesia, pain management type facilities, you're going to use the medicine codes and the anesthesia codes. If you're going to be a surgical coder and biller, you're going to use the surgery code. So again, it gives you the surgery guidelines and all the surgery codes according to the 12 systems of the body. Now, I say 12. My heart, I say 13. When you have the reproductive system, you have the male, you have the female, but it all discusses the urinary system. So it breaks down in 2 parts, but they consider it as one system, okay, because it's all dealing with reproductive. So it's 12 systems, but to me in my heart, it's 13. Okay, now you have radiology guidelines, and then all the listing of the radiology codes. Pathology guidelines, all the pathology type of codes. Medicine guidelines, these are your injections. These are your different medicines that they give in the chemotherapy infusion suites, the iron infusion therapy, different infusion therapies, if you will. All these codes come from the medicine category. So I'm going to turn that page over. So here we have the medicine category. And then we have the Category 2 codes where it talks about modifiers, composite codes, patient management, patient history, physical examination, things of that nature, and other additives in the table of content of this book. Now we're going to get further along in this book, and this gives you a nice introduction of this book. That's why I say kind of treat this like I would kindergarten. So we're going to go through page by page. Now, the reason why I go page by page in the CPT book, as well as I do the ICD-10 book, is because when I finish teaching you in my class, Ms. Harper is not going to be in your back pocket. You're all going to have to know how to survive on your own. Now, you can call me. You can text me. Huh? Facebook. Okay, that's fine. You can Facebook me. You can voicemail me, email me. I'll give you some advice. But now there are times when you can't get a hold of me. You're going to have to know how to utilize this book. Okay? This book, make this book your Bible, your personal Bible, your personal friend. Okay. Now, the section numbers and what it's all for, the introduction for the use of the CPT code book. So you give yourself some opportunities to do some self-education, but also you can get formally educated in the classroom. And here's some more application knowledge about this book. And then this talks about the category specific requirements, the category 2 codes, category 3 codes, and some more coding guidelines according to Medicare, Medicaid services. Here we are, we're talking about the add-on books. The add-on codes, some more information about the modifiers, the place of service reporting, the unlisted procedures or services, and that's a rarity if you work for a specialized physician that does maybe telemedicine. You know, if you live in Alaska somewhere and they have to do telemedicine because Alaska is not like your typical city and state. They have to fly to certain parts to get to certain parts. So that's what telemedicine is mostly utilized there in Hawaii and Puerto Rico. Puerto Rico is another state of ours. Okay. 2018 electronic formats. Okay, so then we come more here about suffixes, prefixes, root words, the numbers. So you get more or less like a classroom in this book. So I like the fact that I'm looking in this book, so it kind of helps remind me what's all in here. We're gonna go page by page. Okay, leave this page. Evaluation and management tables. Okay. This is a good table to go by. It tells you how to categorize a code according to this table. Sometimes you have what they call your super bill. You have a CMS 1500 form, and then you have what they call a super bill. A super bill can be used in place of medical billing, okay? Even you could utilize it, I want to say electronically. So there's a super bill, and then there's a CMS 1500 form. The super bill is more catered to that physician's office. So if you are a family practice doctor and you know you only see certain types of patients on a routine, let's say 4 days out of 5 days a week, and it's rare you see patients for other things in the family practice realm, you can basically use a super bill and still utilize that. But it has to be recognized and approved by CMS 1500. It kind of shortens and lessens the confusion of the physician when they want to mark, okay, yeah, I saw this patient for this. Okay, take this back up to the front. It kind of shortens the paperwork routine. So that's the third form, but that's only used for outpatient physician services. Okay, so now we're going to come to the evaluation and management. And notice that your book has different color codes on the tab for a reason, to tell you what section of the book you are in, okay? Like that. Okay, so evaluation and management, it basically talks about how a patient came in to see a doctor as a new patient or an established patient. The family history gives all those variables. So you have to measure how a patient was seen. So I'm going to let y'all read all the guidelines for that. And so here we are with the E&M codes. We call them E&M codes, but they're called Evaluation and Management Codes. Okay, so this is the Evaluation and Management Codes. Okay, so this starts with 99201. So let me erase this board here, kind of help give you a better view.
What did you say this on?
Evaluation and Management. So see where it says new patient?
Yeah.
Okay, so E&M. Okay, so it starts at 99201 and it goes all the way to going to the end of the red section. Whatever that last page is in the red section is what you want to see. Yes.
99499.
Yep. Thank you. 99499. Okay. And the next category is that anesthesia. Okay. Anesthesia starts with what code? No, it's 00 something. 00. 00100. And where does it end?
00199.
0
No, 01999.
01999. Is that it?
Yeah.
Okay. And what's the next category?
Surgery guidelines.
So you have your surgery codes. Okay, so now we're going to break this down a little bit more defined. Your surgery codes begin with what number?
15999.
15999 69979. Now, here's the thing. I want y'all to go. Hold on. Now, see what it says? The integumentary system general. Okay, so it begins with. Oh, the surgery code starts with 121. Go back to page 75. See it? On top?
10021.
Yeah. So let me erase this.
Oh, it's the blue.
Okay, so what is it again?
Hold on. That's
There was this one. We're in the surgery guidelines. The one that we're in right now is the integumentary.
yeah, the secretary is 10021.
Okay, that's it. Hold on just a minute.
Surgical codes are different.
Yes. Okay. And this deals with 69990. Okay, now 69990. Okay, now it starts from here and it ends here. This is the whole category of the surgical codes. Okay, now for the integumentary system, so let me write this in red.
Miss Harper.
Yeah.
What version do you have that one in? Is that 2018?
This is 2018. Is yours 2018 or yours 2017?
2018.
Okay. So I'm on page 75. Okay. So
It says surgery code.
right. So underneath the surgery codes, you have the list of the body systems. Okay. So you have the integumentary codes. Integumentary codes deal with dermatology. Okay. In other words, skin. So if they have to do a skin graft on a patient, or you happen to do a remove skin tags on a person's face, or maybe there's some lesions that happen, you have to remove a ringworm, things of that nature. That's going to be within that system. So this is a lime green system. So integumentary begins with 10021.
And it ends at 1949.
Okay, 19499.
Also, so surgery codes are broken up into 3 different sections. Or
6.
6 different sections.
Yes. About 6 or 7. About 6. Okay. What's the next colorful tab after that? It looks orange.
That's a muscular skeletal.
Okay. Musculoskeletal. Hope I'm spelling it right. I should have put integumentary systems so I don't confuse you. Okay. This is dealing with the bones. The bones, ligaments, musculoskeletal. Bones, ligaments, muscles, joints. Okay, anything dealing with the musculoskeletal system. What code would that be a part of?
20005.
Is that the beginning code? 20005 to 2999. Is it 4 nines?
Yeah.
Yes.
Okay, 4 9. Okay, very good. What's the next system?
Cardiovascular.
Cardiovascular. Okay, so if you're going to be a biller, cardiovascular, vascular system. If you're going to be a biller, yes.
No, wait, next one is respiratory.
Oh, respiratory.
Yeah.
Okay.
It looks like the same color. It's a little bit lighter than that.
Oh, okay.
Sorry.
That's okay. That's okay. Now, respiratory, we're going to come back and talk about that in chapter 10. Respiratory system. Okay. And that's dealing with the lungs, the bronchioles, lungs, bronchioles, the pharynx. Okay, things of that nature. Okay. What is the code? What are the codes?
3,000,000. 4 zeros.
Okay, 2.
32,999.
32999. Okay, fantastic. What's the next one after that?
Cardiovascular.
Was that the bill for me?
No.
Okay. Cardiovascular system. Okay, and what is the code? Okay, now this is dealing with the vascular, which is just like the aorta, vein, blood vessels, the heart. Okay, what category does that start?
33,010.
33,010 to
39,599.
39,599. Okay, what's the next one?
Digestive.
Digestive system. Okay. This is the system that bariatric doctors may use. Okay. So this is dealing with the stomach. This is dealing with the intestines. Okay, be it large or small. Okay. This is dealing with the esophagus. Okay. Now, what category of numbers are they?
40490.
40490.
49999.
49999. Okay. What's the next one?
Urinary.
Urinary. Okay. Okay, so the urinary system. This is dealing with the bladder. Okay. Men, you all have prostates. Women, we don't. This is going to be dealing with the kidneys, ureters, where the kidneys excrete the fluid from. Okay, what is the sister code to that?
50010.
50010
010
to
53899.
53899. And what's the next one?
Male genital.
Okay, male genital. Okay,
54000.
54000 to
55980.
55980.
Yes, ma'am.
980. Okay, and then female, right?
Female genital.
Okay, hold on. Okay. All right, so you have female. Okay.
56045.
56045 to
60699.
60699. Okay. Now let me back up for a minute. For the male, you're dealing with the penis. Okay, you're dealing with implants if needed. Okay, you're dealing with the urethra. Men do have urethra. Urethra. Okay. And then the foreskin. Okay. And that's, for babies when they're born. Women, we're dealing with the vaginal area. Okay. We're dealing with, again, the urethra. Okay. We're also dealing with births. Okay. Contraceptives. Contraceptive procedures. So we're going to use PX procedures. Things of that nature. Okay. All right. Is it any more for surgery?
Yeah.
It is?
Nervous.
Oh, the nervous system. Okay. So I'm going to have to erase that. Do y'all want to take a picture of this? By chance? Okay. And the reason why I'm writing it like this so you can have a better view of how to utilize your book. If you're going to be a dermatology medical coder biller, this is where you live. If you're going to be a orthopedic medical coder and biller, this is where you live. Respiratory heart doctor, this is where you live. Digestive doctor, bariatric surgeons, this is where you live. Urinary system, if you're going to work for a doctor that deals with urinary and I can't think of that. Urologist, there you go. This is where you live. If you're going to work for OB-GYN doctor, this is where you live, okay? Urologists see men at like an OB-GYN would see women. They do. Okay, you have some that specialize with that, and some urologists just specialize in the urinary system. That's it. And then you have some urologists that will see men for male problems and do all their checkups and do their hemoccult exams and stuff like that. It just depends on which one specializes in what, but this is what you see. So I'm going to erase this. And so if you out there in YouTube land, if you're writing this down, that's great. Then have it hanging on your wall, have it hanging on in your cubicle, so it'll help remind you where things are. Okay, and it'll help you be astute in coding. Also, be mindful. You want to stay open to other billing opportunities. Don't just because if you do OBGYN coding and billing doesn't mean you can't do cardiovascular. The rules is as long as you read the guidelines, you learn, you network, you talk to your insurance company, they educate you. Sometimes you have a customer service rep that just ain't got the patience and the time to educate you on what you need to know from the provider standpoint to help out. But on the majority, there are nice kind of people that will help educate you on what you need to know for you to do your job proficiently. Always make sure that your coding books every November 1st is changed and updated. If not, you're going to get a lot of rejected claims or majority rejected claims. And I've had students in the past, Ms. Harper, they won't tell us, oh my God, we got rejected claims. What do we do? Do you have your book updated? No, we don't have it updated. Did you call the insurance company and ask them what was the new code? Sometimes they'll tell you. They won't tell us, they so mean. Well, then you're going to have to go buy one. Your doctor needs to buy a book. They need to buy a book and supply y'all with books. Okay, moving right along. I'm going to erase this, and we're going to keep on going under the category of surgery. Okay? All right, so did someone tell me, what was the next one?
Eye and ocular.
Indexia?
Indexia.
Okay, eye, ocular, indexa. Okay, and this is dealing with the eye, the eyes, the eyelid. Okay, cataracts. Okay, all things your eye exams, your basic eye exams. Okay.
So if we work for an eye doctor, that's what we're doing.
Like if you all do visual fields, sometimes they have you look into this machine and they want to see, can you see anything blurry coming up like this? Okay, now we're going to puff some air in your eye to see how you react to that. Do you see any floaters? That is your category if you're going to work for an eye doctor. Okay, now let me explain this in reference to eye doctors. You have eye doctors. You have one that's an optometrist, and you have another one that's an ophthalmologist. An optometrist can do a basic eye exam for your glasses and maybe tell you some other generalized things about your eyes as far as diabetes and things of that nature. And then if it's something higher realm outside of the optometry licensureship, they can refer you to an ophthalmologist. Well, the ophthalmologist can actually do the surgeries, can give you a higher dose of prescriptions, and maybe some kind of therapy type for your eyes for you to activate. Hi, sweetie, your eyes. Okay, give me just a moment. Let me take a pause. I just want to say that for the ophthalmologist, they do surgery. Okay, so I don't want you to be so caught up being a biller to where you're saying, well, how come they're not doing surgery codes? Okay, is that doctor an optometrist or is he an ophthalmologist? You have to study and know your doctor, and then you have to know your rules accordingly to what you do in billing. Okay, fantastic. What is that code for the eye, ocular, and indexia?
65091.
65091
68899.
68899. Okay, super fantastic. And what's the next system? Is that it?
Auditory.
Auditory? Okay. So this is your ear, nose, and eye doctor. Auditory. Okay. These are your ear, nose, and throat. Okay. So the proper term for this doctor is called Otolaryngologist. I know that sounds like a long term that sounds like a dinosaur, right? Okay, so everyone say Otolaryngologist. Okay, so there go my bell. Give me 5 more minutes on the clock. Thank you very much. Okay, so otolaryngologist. What does an otolaryngologist do? I'm glad you asked. Okay, they care also for the pharynx, hope I spelled that right. The ears, okay, whether if your kid needs tubes in their ears or you having vertigo issues, especially if you're my age, 49. If you're dealing with ear infections, sometimes they will see you for TMJ issues or AT, which is arterial temporitis, and they have to do a biopsy to properly diagnose that. Ear, nose, throat, they see also for your nose or nasal issues, okay? And sometimes they work in conjunction with the respiratory doctor if they feel that if you snore, have a snoring issue, you get referred to a respiratory doctor or a sleep doctor, if you will, and they will put you on a lovely CPAP machine. I hate my machine. But anyway, what is that code section?
69000.
69002.
69979.
69979. Any more surgery subsections?
That's it.
That is it?
Yeah.
Okay. So that is all it, plus the other subsections that we talked about earlier. So everything goes from 10,021 to 69,990. Okay, so all that is considered to be part of the surgery section. And let me also say, if you're going to work for surgical doctors, make sure that you know your physician. Not all physicians are the same. Okay, I work for physicians where some specialize in the breast, some specialize in skin tags and lesions. Some specialize in gallbladders. Some specialize in removing hemorrhoids. Some specialize in moving hiatal hernias, different other type of hernias. Study your physician and what their certification is, because not all surgeons are licensed to do and function the same. Okay? All right. So we're going to move right along. What is the next section of the CPT book?
Radiology.
Radiology. Okay, fantastic. So I'm going to go back to the blue writing. Let me know when I'm down to 2 minutes. Okay.
It's 2 minutes.
Okay, so I'm going to write radiology on here. Radiology. And then I'm going to stop the film so that I can expound on radiology, and I think after that it's going to be pathology. Okay, so thank you guys so much for paying attention, and I'll be back to recording for number 3, video number 3.